Hello, good afternoon, everybody. Welcome to this webinar on sanitation and health policy guidelines. This is a webinar organized by CSE School of Water and Waste in partnership with WHO, World Health Organization. And we have eminent speakers from World Health Organization, Kate Medico, the team leader, and Sophie Boyson, who would be interacting with you in 5 minutes. I would like to give you an overview before we start that we have around 100 people registered and 55 online. I think we're expecting some more people to join in a couple of minutes. And we are hoping that this webinar would be an interactive webinar. And the School of Water and Waste has started this series of inviting eminent people to either face-to-face training program where they can contribute as experts such that the community of practice can interact, or through state-of-the-art tools through webinar and other places where the community of practice which CSE is developing can interact across the world with the eminent people. So with this purpose, we run series of online courses. So we had some discussions with our partner WHO in this regard, that we have 2 online courses going on and around 100 participants, and we wanted some inspirational talk and which could give the participants some idea about that what are the core issues and challenges they face in the water and sanitation area. So with this beginning, we started, and we also opened up this webinar to all other people who are interested to attend this webinar. And once again, we welcome all the participants and the experts from WHO. Kate, would you like to say a few words before we move on to the presentation by WHO?
Sure. So my name is Kate Medlicott. I'm the Sanitation and Wastewater Team Leader here at WHO, based in Geneva. Within our team, we work on things like the Joint Monitoring Program, which you may be familiar with, on water and sanitation. We interface with the health sector, and we develop normative guidance to support implementation of water and sanitation programs in countries. So today we want to give you an overview of the new guidelines on sanitation and health that were published in October last year. And we hope that with this presentation and following discussion, it will encourage you to read more into the guidelines yourself, and we can have a discussion afterwards to clarify any of your questions and to start thinking about how these guidelines might be relevant for your work. So Sophie will provide the main presentation. I'll hand over to Sophie to introduce herself.
Thanks everyone for joining the webinar, and thanks CSE for organizing it. My name is Sophie Boisson. I work in Kate's team, and I will shortly start the presentation. As Kate said, I think it's really an invitation for you to dig deeper into the document yourself, and we'll be happy to answer any question that you may have afterwards. So I will share my screen and start the presentation, if that's okay with you, Suresh? Okay, thank you.
Yeah.
Okay, can everyone see the screen, the presentation, the slide clearly now? Right, so I will get started. So, sanitation really is about preventing diseases and promotes human dignity and well-being. So in that sense, it's making it the perfect expression of WHO's definition of health, which it's not only about disease, but it's also a state of complete physical, mental, and social well-being. So it's not merely the absence of disease or infirmity. And so the guidelines really recognize that safe sanitation system really underpins WHO's mission and its strategic priorities. So the first question you may ask is, why are these new guidelines needed? Well, as you may know, recent evidence on sanitation has shown that we may have less health impact than we might expect. And that could be due to many reasons, and some of which we will discuss later on. But in parallel, we've observed that often the ministries of health, their role in sanitation and their engagement has declined over the last 50 years. And it's really recognizing that sanitation is really critical for primary prevention and to get out of response mode. For example, prevention of diseases like cholera, but also accelerating and sustaining progress to eliminate diseases like neglected tropical diseases or to combat emerging threats like antimicrobial resistance. And in the meantime, there was also a kind of lack of public health guidance that really look at that brings together all the elements needed to maximize the health gain of sanitation. So that includes behavior change, technology, policy and planning, and management, and as well as disease control. So what you see here on your screen is the guideline structure. It's composed of 4 parts, which I will describe in more details during this presentation. But before I do so, I wanted to talk briefly about the methods. And so the diagram that you have in front of you here, you don't have to read it in detail or understand it in detail, but it's just to highlight that the guidelines have been developed in the most rigorous scientific process. It involved an extensive review of the literature, including over 1,000 studies, and it also involved a wide range of experts' input, as well as input from end users and practitioners. So I just wanted to emphasize the rigorous process that we had to go through in order to develop these guidelines. So introduction, scope, and objectives. So the primary objective of the guidelines is to maximize the health impacts of sanitation intervention, but also is to be very clear about what the role of the health sector is in sanitation. As you know, as we all know, sanitation is delivered by a multitude of stakeholders, not only health, and therefore the audience is broader than the health sector. It includes national and international organizations responsible for developing policies, standards, guidelines, and programs on sanitation. So, just looking at this table, when we think about sanitation, the first outcome that comes to mind is often diarrheal diseases. And this table shows looked at a number of health outcomes. And so not only diarrheal diseases, it's looking at the direct impact of sanitation on infection. So thinking about infection, it's not only diarrheal pathogens, but also we can include helminth infections, insect vector-borne diseases. The guidelines also looked at the sequelae from sanitation, including stunting, the consequences of stunting, impaired cognitive functions, pneumonia, and so on. And we also looked at broader well-being outcomes, including anxiety, sexual assault, adverse birth outcome, as well as long-term effect on school absence and as well as emerging aspects like antimicrobial resistance. So what you see on this slide on the bottom right corner is the F diagram that I'm sure all of you know well and have used in the past, and that diagram have been very useful and for all of us who've worked in the sector, and it's been used for the last 50 years. Perhaps it just focus on open defecation and perhaps it oversimplified the relationship between sanitation and adverse health outcomes. So what you see on your left-hand side is an updated version of this F diagram, which really aims to, excuse me, which really aims to unpack the different risk factors along the sanitation chain and how these hazards and exposure routes can lead to disease outcome. So now section 2, the recommendation and good practice action. So in chapter 2, you will find the recommendation of the guidelines, and as I said earlier, they are derived from a really comprehensive evidence review and wide expert and user input. So what I will do now is go through the 4 key recommendation areas, and I will paraphrase some of them for you, but it's really the aim is really to invite you to go through these recommendations and read through them and dive deeper into the chapter. So the first recommendation, really one of the key points is really about universal access to toilets that safely contain excreta. And I think really the critical point here to highlight is the importance of ensuring entire community coverage with a minimum level of service. And in order to do that, you may use demand side and supply side approaches concurrently. You may promote shared or public facilities if it's necessary to reach everyone. And again, this is not only about households, but ensuring that there is toilets that safely contain excreta in all settings, including schools and healthcare facilities and so on. And in line with the human rights to sanitation, obviously ensuring equitable progress. Recommendation area number 2 is on the safe sanitation chain, and by now I'm sure you're all familiar with and very used to think in terms of the whole sanitation chain, from containment, transport, treatment to end use and disposal. So in this chapter, it's recognizing that there's a number of technologies and services that are needed to ensure a safe sanitation chain, and that one technology or system, one single system or technology alone won't be sufficient. So in that sense, the guidelines are really technology agnostic. It recognizes the importance of designing solutions that are really context specific. He also highlights that that incremental improvement is needed when it's not possible to achieve really high standards, and that should be based on local level risk assessment. And WHO's recommended approach for that is sanitation safety planning. And then finally, the recommendation area 2 talks about the importance of the protection of sanitation workers. I mean, we all know that they are among the most exposed population to sanitation-related health risks, but they are often, not involved in the decision-making process or the design of sanitation systems, but they also are a key player in ensuring that sanitation systems are safe. Recommendation area number 3 is about ensuring that sanitation is coordinated in the context of local services provisions. So there are lots of efficiencies to be gained in linking sanitation with other services like solid waste management, transport, communications, but also it recognizes the importance of coordinated interventions and programs to ensure sustainability. And that includes coordination with other interventions, including water supply, hygiene, management of child feces, or animal waste. Recommendation area number 4 highlights the role of the health sectors, and as we will discuss a bit later, you will see there are 7 key functions that describe how the health sector should be engaged in sanitation. So in chapter 2, you'll also find a number of good practice actions. So it talks about multi-sectoral policies, planning processes and coordination, ensuring health risk management is adequately reflected in sanitation legislation, regulation and standards. Again, how to support the role of the health sector in sanitation, how to undertake local health risk management, to prioritize improvements, around enabling marketing of sanitation services, and also important sections on management of special risks like in emergencies, outbreaks or health facilities. So now these recommendations are supported by chapters or implementation guidance. So in chapter 3 on safe sanitation systems, what you will find is a definition for safe management. So it includes information about design and construction, about operation and maintenance, as well as a number of incremental measures. And just to highlight that those definitions that you will find in chapter 3 are completely aligned with the joint monitoring program definitions. However, the definition of the JMP have really been developed in order to be able to quantify and measure and count, whereas the definition that you will find in this chapter provides more nuance and more details for programming. Chapter 4 is really the chapter that describes the how to deliver safe sanitation services. So I won't go through each of the areas in detail, but it touches on policies and planning, again, legislation, regulation and standards, definitions of role and responsibilities, the how to do local level risk assessment, and of course, because sanitation is, is also strongly implemented by the private sector, includes some section linked to business models and the sanitation market. And finally, it includes a section on the management of special risks, as mentioned earlier. Chapter 5 is focusing on behavior change, and often the first intervention that comes to mind when we think about behavior change and sanitation is often community-led total sanitation. Well, what this chapter does is really taking a step back and really encouraging us to think beyond, and really emphasizes the need to understand the key determinants of sanitation behavior and to design approaches and intervention accordingly. So what you will find here is a short description of the different steps involved in designing an effective behavior change strategy. And you will also find some guidance on role and responsibilities around sanitation behavior change, as well as some information on monitoring and learning. So there's a number of technical resources to support the implementation and the guidelines. In Chapter 6, you will find lots of information related to excreta-related pathogens. As I mentioned before, you have the updated F diagram, and you will find lots of information about those key pathogens, and then about treatment and control measures, but also includes issues around antimicrobial resistance. And you will find these tables that again describe what I just said, organized by pathogen class, bacteria, viruses, protozoa, and helminths. Now, Chapter 8. Chapter 8 is summarizing the evidence on the effectiveness of sanitation intervention and their implementation. So just to give you a very brief overview, and again, I couldn't possibly do justice to the amount of work and the amount of studies that have been published and reviewed, but I just wanted to touch on a few points. So first, I think the evidence review really showed that in order to have a significant impact on health and on transmission, you really need to have a high level of coverage and use. But overall, there is a clear evidence that sanitation has a protective effect on infectious diseases and nutritional outcome. And there's also an evidence of an association with wider health outcome, including cognitive development and personal well-being, and so on, especially among women and girls. However, and it's important to have this in mind, that the strength of the evidence is generally low, and I think we have to be very, very cognizant of this. And that there are a number of gaps that still remain to be addressed, including in epidemiological, implementation, and other areas of sanitation research. And just to touch on the first point around the importance of reaching high coverage and use, especially at the community level, I wanted to introduce this diagram, which was from a paper recently published that developed a fecal contamination index from the recently published intervention studies looking at the impact of sanitation on diarrheal diseases. And what this paper did, what the team did, was to develop this index of contamination. So if you see on the graph on the x-axis, you will see this index of fecal contamination. So with 16 on your left-hand side is very dirty environment, and 3 on the right-hand side is a very clean environment. And they've plotted the relative risk for diarrheal disease obtained from those key studies against this index of contamination. And what this diagram shows is that you really need to have to achieve a very clean environment in order to start seeing a significant impact on diarrheal disease. And excuse me. And then that's if you look at the recent GMP, the data from the recent GMP report that looks at inequalities, you can see that a significant amount of people are really exposed to open defecation, and you will see on the figure on the right hand side that if you can see, you have different countries, and for each country you have in dark brown the proportion of households that report open defecation, and then on the light brown you can see the proportion of households who live in a community where at least one household is reporting to open defecate. So you can see that that the level of environmental contamination and potential for exposure is much higher than what we might expect. And on the left-hand side, it's just taking an example from a country, showing again that if the number of people in a community that are exposed to fecal pathogens because at least one member of the community open defecate, it's actually much higher. So chapter 9 is, as I said earlier, the strength of the evidence is low, and we've identified a number of research gaps. And so if you're interested in research, we really encourage you to go through this chapter where you will find further information on those gaps and future research need. But just wanted to show the conceptual framework here that we've used for the guideline development, and it really shows the causal pathway, so through which a sanitation intervention impacts health. So, and the reason I use this diagram is to highlight areas in the evidence that we found significant gap, especially. So while we have a fair amount of studies that have looked at the impact of the sanitation intervention on access and use and health outcomes, there are few studies that document in great detail about implementation and effective implementation approaches to sanitation, and there's also a few studies that document how these interventions impact fecal transmission within the environment. And so, so just to highlight that implementation research and how intervention impacts how pathogen moves and are transmitted in the environment are really important gaps that have been highlighted. So finally, there's a number of supporting tools linked to the guidelines. So you will find in Annex 1 a series of sanitation system fact sheets, which represent 11 of the most common sanitation systems. It covers applicability, design consideration, as well as measures to protect public health. And we also have sanitation system inspection forms, which were just published in our website a few weeks ago. And some of you may be familiar with the sanitary inspection form that were developed for water supply systems. So these forms have been developed with a similar aim, and in order to really be able to do a very quick and simple evaluation of potential health risks that may be linked to a specific sanitation systems. And so these forms are really at the draft stage. And so we would like, we really encourage you to provide feedback, and also, and potentially, if you're interested, to also pilot them in the field. Something that is also coming soon is the excreta related pathogen fact sheets, which are closely linked to the table that I was presenting before, and the chapter on chapter 6 of the guidelines. And this fact sheet will include a lot more detailed information about each pathogens, and information about how its transmission in different environmental media. Okay, well, thank you very much for staying with us, and really encouraging you to dive deeper into the guideline yourself, and going through the content yourself. So now,
thank you, Sophie.
Yeah, thanks, Suresh.
Thanks for the interesting presentation. We would now go to the quiz session, which Kate, you would take it.
She will join us later for the question and answers.
Okay, so you want to proceed with the quiz session?
Yeah. Okay, so I hope you are all still awake. And so in order to make this session a little bit more interactive, we will ask you a few questions. And so if you wish, you can type the answers into the chat box. And yeah, as soon as we see like quite a few answers, we will give the answer on the screen. So question 1, what is the ultimate health outcome the guidelines aim to support? So I'll let you read the answers. Number A, B, C, and D. I give you just a couple of a minute to think about it before we give the answer. Okay. So I haven't seen any answers just yet, but I will let you maybe. Yeah.
So we can see the answers here, and we can announce if you want who has given the right answers. Or you want to...
Maybe give me the general consensus.
C. Many people have said C.
So many people have said C. So is that the correct answer?
Well, I'm trying to. I can't move my. Sorry, I'm having some technique.
So I can see out of the 70 participants, C is the good. So if you want to move to the next one.
Yeah, that's great. So as I said earlier, I think when we think about sanitation, we should think about the health impact in a more holistic way, and not only focus on a few.
You have quite a lot of people awake.
Yes.
Right. So should we go to number 2? So
Yeah.
what does WHO recommend with regards to shared facilities? Number A, B, C, or D? Has everyone got it? So I'm sure like most of you got it right, but it's number C. So as I said earlier, the guidelines recognize that shared sanitation is an incremental measure towards a higher level of services. So it's an important measure if it means that reaching everyone with toilets that safely contain excreta. So now we move on question number 3. So what is the role of the health sector in sanitation as defined by the guidelines? So I let you read the possible answers again. Okay, so I'm sure most of you got it right as well. So the health sector should fulfill core functions to ensure safe sanitation to protect public health. So what you will find in the guidelines is different function of the health sector. So that range from supporting the development of norms and regulation on sanitation that are health protective, that may include ensuring that information about disease endemicity is being shared and can inform targeting of sanitation interventions to area where the disease burden is highest. That includes ensuring that all healthcare facilities have access to adequate sanitation facilities and so on. In these figures, it's really highlighting that it's really not suggesting that the health sector should lead on sanitation necessarily, but it just highlights that, you know, at least there should be some coordination with other sectors to ensure that the health perspective and the health element is reflected in sanitation policy and programming. So let's move on to question 4. How do the guidelines define safe sanitation systems? So again, I let you read the possible answers. Okay. So I'm sure you all got it right again. So of course is answer B. I think it's fairly straightforward, and as I highlighted earlier, I think there's a clear this definition that you will find in the guidelines are really aligned with the GMP, but there's a clear distinction between the two in that the GMP definitions are really for counting and monitoring purposes, but the guidelines definition are a lot more nuanced and can be used for programming purpose. Number 5, how should local authorities prioritize improvement and manage system performance? Okay, so most people are saying A, so that's great. So WHO's recommended approach is sanitation safety planning, but I'm sure you're all very familiar as well with the excreta flow diagram. But I just wanted to highlight that both approaches are very complementary. So while the excreta flow diagram is is great at mapping the situation at the city level, and really as a important advocacy tool, and to get a big picture of what's happening. The sanitation safety planning approach is really digging deeper and doing a risk assessment at a much more local level. So both approaches are complementary. So number 6, which sanitation technology is the best for protecting health? Okay, great. As of course number D. And in chapter 4, you will find an example of how unsafe technologies can be phased out over time. And you can also find different type of sanitation systems and their applicability based on a number of physical factors, but also enabling factors. So number 7, what is the best way to get people to change their sanitation behaviors? Again, number D, that's right. And I guess, I mean, there's nothing wrong with answer A, B, and C, but I think the point here is to say that, you know, it's important not to use just one approach and assume it will work in every setting. And so it just highlights the importance of understanding what drives sanitation behavior in order to be able to design a specific effective behavior change intervention. Oh, and that slide is again highlighting the different stages in sanitation behavior change strategy design. Number 8, we're getting close to the end, but how sure are we that safe sanitation systems have a beneficial impact on health? Okay, so it's number A, and as I has said earlier, I guess that there could be some, you know, some good reason to say D as well. But as mentioned earlier, we know that, you know, sanitation is associated with improvement of health in health, but the quality of the evidence tends to be low. And I already went through this diagram before, so I won't repeat it again. So in the interest of time, I will stop here, and thank you very much, and hope you'll get a chance to read through the guidelines yourself. But now we have a Q&A.
Thank you, Sophie, for this interesting presentation followed with quiz. And I hope the participants enjoyed the format, how it was done. We have a few questions. Sophie, now would you be able to take these questions? I can read out the questions, you can answer it because I think you can't see from there, and then shall I read out the question?
Yes, if you can read them out. For some reason, I'm not able to see them on my screen.
I'll read out from here, and Ruhil will type it out the answer so all other people can see it.
Mm-hmm.
So now I'm reading the first question. It is by Hemant Arora. In one of the slides, you showed a graph interpreting diarrhea impacts of water sanitation and hygiene. What was your area of study, country and city?
And study. Oh, was it the slide showing the fecal contamination index? And that slide was showing, yeah, it was plotting the level of contamination the estimated level of fecal contamination in the community versus the relative risk of diarrhea. And it was using information from intervention studies which have been conducted in a number of regions and a number of settings, including India.
Okay, so not any specific one, but it's international data. Okay, so the second, yeah, good. So second question is by Kumar Gautam. Elaborate about stunting and growth flattering. What do you mean by that? Stunting and growth flattering.
Okay, so stunting is being too short for your age, and we know that there's several mechanisms through which this may happen, including repeated episodes of diarrheal diseases early in life, but also a number of helminths and parasitic infections, but also a potential reason may also be environmental enteric dysfunction, which has been hypothesized as a possible cause of undernutrition and stunting among young children living in highly contaminated environments, which highlighting that if you're exposed to a lot of fecal pathogens early on at a young age, this may affect the gut lining and impact on the gut system.
So I'll go to the next question. The question is by Namrata Mahal. If the speaker can elaborate a little more about incremental measures in safe sanitation.
Mm-hmm. Okay, so incremental measure in sanitation, and the example that I gave earlier is shared sanitation. If you look at the evidence, there's a number of studies that suggest that sharing a latrine with more than several households can have a negative impact on health and increase your risk of diarrhea. But actually, if you look at the literature more closely, there may be several reasons for that. And of course, for example, operation and maintenance mechanism for cleaning, actual use of the facilities, again, like all have an impact on potential health risks. So just to say that shared sanitation is not necessarily, is associated with some risks. So including, as I said, potential infectious disease risk, but also risks of assault, or if you have to, for example, for a woman who has to walk a long distance at night, obviously there's some clear safety issues. So it's just to highlight that this is not a perfect situation, that there's a number of risks associated with it, but if it's properly managed and properly and it's properly maintained and so on, then it could be, and that the waste is safely contained, then that could be considered as an appropriate control measure until like every household has access to safe toilets.
Okay, I'll move on to the next question by Sandhya B. How do we eradicate helminth from FSTP? Any idea? Sophie, can you hear me?
Sorry, yeah. So can you just repeat the question? Sorry, I wasn't clear.
The question is, how do we eradicate helminths from FSTP, or by using FSTP? How can we eradicate? Maybe the technology-wise, I think the question is, which technology can get rid of helminths?
All right, which technology would work best? Well, you will find in again, like in table in chapter 3, you will find the capacity of different waste treatment technologies at reducing different class of pathogens. So you will have information on those 3 groups: virus, bacteria, and
Okay.
so you will find a bit more information on this.
Okay. So one more question by Elliot. Entire community coverage is ideal, but minimum threshold for community coverage to start seeing significant health effects, no. I don't know what the question is. But what is the minimum threshold for community coverage to start seeing significant health effects?
Okay, so I would say that it's a bit of a dangerous answer. I would say that what we found in studies we looked at, we start seeing significant decline in diarrheal disease at about 70–80%. But again, I think it's important to highlight in that case that that's where you start seeing decline. And so if you reach 100%, you will see an even much bigger impact. And also, I think it's the reason I said it was dangerous answer, because we have to be careful in putting a number onto it, because this may vary depending on the setting, depending on the pathogen circulating in the environment, and so I would say, it's not like we reach this and then we say, oh, we can stop now. No, I think that's where you start, seeing greater reduction in diarrheal diseases.
Okay. The next question, I think this is the last question which I'll take, by Sachin Joshi. Please elaborate on the microbial resistance.
Okay.
Yeah. Do you want me to take that one?
Yeah, maybe I let Kate answer that, because she's done a lot more work on this area.
Yeah. So antimicrobial resistance, I mean, there's a lot going on in this area at the moment. And firstly, there's a nice summary in chapter 6 on antimicrobial resistance. So I would encourage you to read that first. In terms of the understanding about how resistance circulates in the environment and what are kind of safe levels, there actually is nothing out there at the moment as what is a kind of a safe level of resistant bacteria, genes or residues. But in many settings, especially ones that haven't achieved 100% universal access to safe sanitation, just doing the things that we know we need to do in terms of entire community coverage and communities and health facilities is going to be a massive contribution to preventing infections that would otherwise be treated with antimicrobials. The discussion on antimicrobial resistance goes a bit wider than just kind of human sanitation, though. Of course, it touches on hygiene in the animal raising sector and also manufacturing of antimicrobials. So that's obviously something that happens a lot in India. We'll be producing a policy brief on that later this year. But for now, I would really just encourage you to read the section in chapter 6 on resistance, describing kind of what the issues are.
Thanks, Kate. We have just touched our time limit, but I was wondering, we have 5-6 questions. Would you be okay to take 1 or 2 more, or shall we share the email ID? So,
sure, if you're happy, you're happy with that.
I'll pick up, not because of any particular importance, but few things which are highlighted on the screen. I'll pick up 1 or 2 questions, and remaining people can write to us, and we can all write to the speaker. That's what we are approach. I'm going to the next question by Sally. Is there an alternative for shared sanitation for women considering their vulnerability?
An alternative for shared sanitation for women?
Considering their vulnerability.
So again, on this, if you read in chapter 3, I think there's a line there that is describing the principles of the kind of functionality that facilities should provide whether they're shared or private. And if the context-specific needs of women who are sharing are not met, are not able to reach those sort of principal levels that are described in Chapter 3, then I think it's more of a contextual matter about how you would design access to the toilets, for example. Could be access, lighting, placement, all of those things would could be modified locally in order to be suitable for women only. So in Chapter 3, you won't see very specific kind of like it must be exactly like this, but this is the kind of functionality it needs to have in order to provide a safe service.
Okay. I'm taking one question by Hafsa Khan. How do you make the issue of wash and health more appealing so that it can sensitize government officials as well as local community?
Well, I think there's a couple of things I'd say to that. Is one, we've tried to be really clear about what is the role of the health sector. Sophie would have discussed that, so that we can get beyond the kind of rhetoric of, oh, you know, sanitation is important for health, to go a level deeper and say specifically these are the roles that the health sector needs to be performing to make sure that we maximise the health benefits of sanitation intervention. So I think that's really key. A second piece I would say is that there was 1,000 studies or more looked at for these guidelines, but there were some recently quite high-profile studies that showed disappointing results. And I think because of that, the sector is more open to reflecting on what they can be doing more to improve on health. And so I think it's a good moment right now to be kind of having those conversations about specifically how do we work more in areas where disease prevalence is higher, and how do we modify our interventions to make sure that we're interrupting transmission of the diseases that are endemic, and then specifically making sure that the health sector is playing their role in doing that.
I'll take this last question. This is by Namrata. Do you think the guidelines should be mandated in the green building rating systems?
The guidelines should be
mandated in the green building rating system. This is a new good practice of addressing environmental issues and all those to reduce the impact of buildings and urban development. So,
yeah, I think so. So just to react to that, I mean, so WHO guidelines, the approach is that within countries, it's you know, up to countries to decide how those are translated into your national policies, multi-sectoral policies, where they, so rather than being kind of copy-paste, you know, into as a guideline, a national guideline, it might make more sense to put them, elements of them, into various different policy instruments. And if the green building ones is relevant in your context, then I think that would be fantastic.
I think I have an international participant who has raised a question, Doreen. She said, how do we encourage implementation of sanitation alternatives in hard-to-reach communities, especially in Cameroon, when wash activities are being carried out only in central cities?
Yeah, so I think this, Sophie, you might want to add, but I think one of the key things here, and it came up in the quiz as well, is that we really need to be using risk-based approaches to decide where we invest. So if the investments are going mostly to urban areas or mostly easy to reach areas, the guidelines' main message is that's not the right way to be going about prioritization. And if you look at it using a sort of risk-based approach, then it will kind of drive the investment towards some of these harder to reach places.
And just to complement what you just said, as I said earlier, The guidelines really encourage the health sector to be engaged in conversation about, where those interventions should take place, because, vulnerable communities outside, main cities are affected by multiple diseases, including, many parasitic helminth infections or undernutrition. And so if that information can be used to advocate for better targeting to those populations, I think that would be powerful.
I would take a call as a moderator to stop here, and if there are any more questions, they can be raised to the speaker. If you are willing, Sophie, we can share email IDs with our participants, or otherwise we will certainly upload the presentation. I would like to thank Kate and Sophie and all the participants who have attended. So just for understanding of all, if I don't know whether this data can be seen by all, we had 150 people registered, but we had 70 people logged in. And as on date till now, 10 minutes past the time which were scheduled, we have 55 people here. And I think it's a very encouraging response. Thanks a lot for taking time out, all of you. And I would like to thank my team who has put together this webinar, Bidush, Marine, both the program managers who are also the training coordinators of the online course which we are running, Rohil and Anil who run the online course, who have played an important role in putting this together. So there's a lot which goes behind the scene. But I'm very happy that the number of people who turned up at a very short notice. I'm very happy about this, and I think there's more to come. I would like to also take this opportunity to announce a training program on sanitation safety planning, which we have developed in collaboration with WHO. It is in the month of September. Marine, what's it? 3rd to 6th September, CSE is going to have a School of Water and Waste is launching another batch of training program. This is 3rd to 6th September, and the audience and participants who are attending this webinar are most welcome to attend and apply for this course. And there will be priority given to people who have some prior knowledge or who have attended the webinars or online courses which are run by CSE. And we have full and part fellowships available for this course. Thank you very much, Sophie. Thank you, Kate, for this interesting webinar. And thanks to all participants once again. Thank you.
Thank you very much. Bye.
Bye.
Bye. Good, thanks.